Hello everyone, and welcome to this audio podcast. Today, this audio podcast as part of a Depiction Imperil. This audio podcast is part of a Storm and Geronimo. This audio podcast is part of the Journal. This audio podcast is part of a Storm and Ostix Chronicle, and this audio podcast is part of a Storm and Ostix production. As part of this audio podcast, a look at a publication by Mohammed and team from around 2018, looking at service evaluation for young people with kidney disease. The This audio podcast will look at around the research gap and approach, and the research gap and approach, and the research in around the research question, sort of strength in around the publication, and then look at sort of the limitations, of the publication. So, as part of the research gaps and approach, the literature gaps inform that whilst there has been some exemplary transitional services between pediatric and adult renal services, there is still evidence of fragmentation of services for young people. As part of the sort of research question. So whilst there was no specific research question, the review or publication looks to inform how delivery of healthcare services can also depend on where young people reside, and which is reflected by sort of the priorities of that area. This makes it challenging for young people to access best practices. The publication from 2018 was had a remit in as part of patient and public involvement, and as part of the sort of strength of the publication. The publication follows on from the Nephrology Network's 2011 report, which focused on access to pediatric kidney care services, and partnerships would not only enable an individual patient to understand health and treatments, thus realizing the model of the expert patient, but would also bring about a deeper understanding of research and interactivity in context of in context of in context of in context of PPI. In around the limitations, the publication informs in on only some aspects surrounding the use of social media, for example, and how this could help achieve integrated services for children and young people suffering with different forms of kidney disease. The design of the publication should have included a case study for healthcare professionals to gain or to attain more informed understanding surrounding young people's services. That draws this audio podcast to a close. This audio podcast as part of a Depiction Imperil. This audio podcast is part of a Storm Geronimo, and this audio podcast as part of a Storm and Ostix Chronicle, and this audio podcast as part of a Storm Lobostics production, and a Storm and as part of the Journal.